Good afternoon, Nico Hidefield. Let's begin the warm-up session. Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Where do you see yourself in 5 years?
In 5 years, I envision myself as a seasoned nurse, working in a challenging and rewarding role. I aspire to deepen my clinical expertise and leadership skills and to become a valuable asset to my healthcare team. I hope to be involved in mentoring and educating new nurses and to contribute to improving patient outcomes through evidence-based practice. Ultimately, I strive to make a positive impact on the lives of my patients and their families.
Do you think nurses should attend continuous nursing education?
Yes, I do. The Continuous Nursing Education Program helps nurses update themselves with the current practices in their profession. Moreover, nowadays, it is mandatory to have specific hours of continuing nursing education to renew the nursing registration. Hence, continuous nursing education is very important for nurses.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want help, and when I can't, that's hard.
Describe your typical working day.
My day starts with prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after I give a handover to the next scheduled staff members.
Your preparation time is over. You can now start your roleplay.
Hello, please come in and have a seat. My name is Aaron Hedge, and I'm one of the nurses here. Before we begin, could I please get your name?
Yes, it's Mihiraa.
Thank you, Mihiraa. It's nice to meet you. Thank you for coming in today. I can see that it might have taken a lot for you to reach out, and I want you to know that you've done the right thing by coming here. To help me understand better, could you start by telling me in your own words what's been bringing you in to see us today?
Well, for the last few weeks, I just feel down all the time. Nothing seems fun or interesting anymore, even things I used to love. I'm just so tired, no matter how much I sleep. It's like a heavy fog I can't shake off.
That sounds really difficult to carry around, that heavy feeling and the tiredness. To get a clearer picture, can you tell me more about these changes you've noticed to get the details of your symptoms?
My sleep is all over the place. Sometimes I sleep too much, but I wake up exhausted. Other nights, I just lie there for hours. I've lost my appetite too. I've probably lost a bit of weight because I just forget to eat or can't be bothered.
I see. Alongside these changes in sleep and appetite and the low mood and loss of interest you mentioned, what are the main things that are worrying you the most right now? What feels the hardest to manage?
I feel useless a lot of the time, like I can't do anything right. I try to read or watch something, and I just can't concentrate. My mind goes blank. It's really frustrating.
That frustration is completely understandable. When people feel this way, sometimes they can also have very distressing thoughts. I need to ask, as it's an important part of how I can help you. Have you had any thoughts about harming yourself or ending your life?
I've thought that everyone might be better off without me, but I haven't made a plan or anything. It just scares me that I think that way.
Thank you for trusting me with that. It's very important that you tell me. Mihiraa, while we work on getting you more support, there are some things you can try to gently look after yourself. These aren't cures, but they can sometimes help create a bit of stability. For instance, gentle exercise like a short walk can help. Trying to maintain a simple daily routine, even with small tasks, can provide structure. A healthy diet, even if it's just small, regular meals, can support your energy. It's also helpful to connect with your support systems like family or friends, even when you don't feel like it. Practicing mindfulness or simple breathing exercises can help manage moments of overwhelm. And it's really important to avoid using alcohol or drugs to cope, as they often make these feelings worse in the long run. Do any of these ideas seem like something you might be able to try?
I think I could try a short walk, and maybe texting a friend. The routine sounds hard, but maybe I could try. If I could get some prescribed medication, I would feel much better.
That's a great start, Mihiraa. Even small steps like a short walk or reaching out to a friend are positive and can make a real difference. I also hear you when you say that starting a routine feels hard. That's completely understandable, and taking it one small task at a time is the way to go. I really appreciate you being open about the idea of medication. It's important to talk about all the options that might help. My role here is to provide initial support and information, but I'm not able to diagnose or prescribe medication. That's a decision that needs to be made carefully with a general practitioner or a psychiatrist, as they are trained to do a full assessment, determine the most suitable treatment, and monitor how it's working for you. What I can do right now is help guide you towards some very effective non-prescription support that many people find incredibly helpful while they are exploring all their options. For instance, talking therapies such as counseling or cognitive behavioral therapy provide a safe space to understand and work through these feelings with a trained professional. There are also local support groups where you can meet others who are going through similar experiences, which can help reduce that feeling of being alone. I have some information here on reputable self-help books and websites that are based on proven techniques, which you can look through at your own pace. These resources can give you practical tools to manage day-to-day feelings and are often a key part of a broader treatment plan. How does that sound to you?
I think talking to someone who isn't family or a friend might be easier. But is this normal? I feel so alone in this.
What you're feeling is very common, Mihiraa. Please believe me, you are not alone in this. Many people experience what you're describing. The most important thing to know is that it is treatable, And with the right support, recovery is absolutely possible. You have taken the first and bravest step by seeking help. Do you have any other questions or concerns about what we've discussed so far?
I guess I'm just worried about what happens next. What should I do?
That's a very important question, and it leads to the next crucial step. I strongly advise you to see your GP. They are the right person to give a formal diagnosis, discuss all the treatment options available, and importantly, to rule out any other underlying physical causes that might be contributing to how you feel, like thyroid issues or vitamin deficiencies. They can create a complete management plan for you. Would it be helpful if I helped you book an appointment with a GP here at the center?
Yes, please. That would take a weight off. I don't think I'd do it myself right now.
Of course, I'm happy to help arrange that. Now, to make sure we're both clear, let me just summarize what we've talked about today. You've been experiencing low mood, loss of interest, fatigue, along with changes in sleep and appetite, and you're finding concentration difficult and having some distressing thoughts. We've discussed some initial self-care strategies like gentle exercise, routine, and connecting with others. I've reassured you that this is a common and treatable condition, and you've been very courageous in coming forward. The key next step is to see a GP for a full assessment and to explore treatment pathways, and I will help you book that appointment now. Does that cover everything from your perspective?
Thank you, Aaron. I feel a bit less overwhelmed about it all.
You're very welcome, Mihiraa. I'm glad. Let's get that appointment booked for you now.